Meeting is now streaming live. Hi, everyone. It's Andra, and I am here with my good friend Karen Walk, a colleague of mine. And I had posted on the pre-video. It should be in gallery. I had posted on the pre-video that if I was ever drowning and I had to get into a lifeboat, that she would be the person that I would want with me. And I mean that sincerely. We worked together at a particular place, and I'll never forget that we would get stuck there for 24 hours straight a lot of times, and we were the only ones running the building. So if her or I left, the other would be alone to do admissions, discharges, and most days take a floor because someone wouldn't show up and they were grossly understaffed. And we were doing gender reassignments at the time. And they're very difficult patient loads, so you really have to have someone available all the time. And Karen would always say she would never leave me alone, and she would take rides 2 hours later to her children in New Jersey at the time. And that's what being part of a great team is really about, and it makes a difference in how well you are at your job and how great it is to have that at your job, because how good your team is only as good as the weakest link. And when she was working with me, I always knew that we were going to have a great day. So anyway, I want to introduce you to Karen. Karen has a master's in public health. She's a nurse, a registered nurse. Also, she has a bachelor's in health science. She does CPR training. She's a girl of a lot of things. So she's always busy on something. As long as I know her, she always has her hands on 20 things. She's a multitasker and a mom. So she's very, very busy, but I wanted to introduce you and say hello to Karen Walk. Hello, my darling.
Oh, thank you so much for having me. Thank you so much for always looping me in. What you have said about me, I really feel about you. I remember working at that facility and learning about gender assignments and how to treat these patients, because it was new. It was new. The hospital that was doing them was learning. We were learning how to help them recover, and you were there learning with me right on. We were just moving and shaking together. I wouldn't have made without you being there. It was so awesome to work with you. Your work ethic, your loyalty to nursing and to patient care is just exceptional.
Thank you.
You have pushed me in so many directions. You have put my hand into so many things that has helped me grow professionally. And I just appreciate you. But thank you for having me on here. I'm super excited.
Yes, I try to have people in, this particular group we're in. This is going to stream live to all my groups, but this particular group started as a weight loss group. And because I was a nurse, it kind of got, and it was my first group ever, it kind of got away from me. And I love health. So I was talking about all health. We were talking about cancer, and then we were talking about heart disease, and we just started talking about everything. But what everything came back to was lifestyle, and we just went through COVID, and we know that medicine is not the way it used to be. You still can't get in to see doctors. So I want them to have people that they can really reach out to and get that help and know that it's quality advice, So you've worked in nursing just as long as I have, and you have to know what lifestyle does to someone, and when they're not caring for themselves. So can you share a little bit about that? I mean, because I know that we've treated people that didn't have the best lifestyle and what that looked like from our perspective.
Right. So I've been a nurse for about 15 years. I've been a visiting nurse, a community nurse for the majority of my career. And I've worked in the poorest to the most affluent neighborhoods in New York City. So I have seen people with food insecurities where they had a little bit of money to buy food. So they're buying their ingredients for their meals from a corner store, a bodega, where things may be expired, high in salt, high in fat. It really didn't help them to even heal, it really just help their disease get worse. Because these patients that I was dealing with, they had diabetes, hypertension, high cholesterol. So those chronic conditions are best treated with diet, right? Because the way it started was a poor diet. So the way it will continue is if you continue that same diet. So in healthcare, what I'm seeing now and what Andra and I share a lot is we don't really do preventative care. And I know she has an awesome platform that talks about preventative care, talks about different foods that can help treat and heal chronic conditions, foods that could just make you feel better as a person, you know, and we don't really teach that in the hospital as we should. So while I've been in the community, when I was visiting patients with hypertension, diabetes, cancer, recent strokes, I would see it would stem from a poor diet. It would stem from a poor lifestyle that a lot of them couldn't really prevent because it is what they were in, right? It's their situation.
So true.
And as I would go into the different homes, I would help them to see different ways, different things they can choose potentially at the bodega. Maybe not the canned foods. They could pick up that orange or that apple, you know, instead of buying that big bag of rice. They could buy a smaller bag of rice, you know, and then different supplements that they can use to treat their condition, you know, just different flax seeds and a lot of things that Andra puts on her platform, papaya and pineapple and kiwi, different things that can really, really help to kind of manage a condition non-pharmacologically. You know, not to say that they don't have to continue to take the medication or listen to their doctor, but these different foods can help to prevent their condition from getting worse. You know, it helps to change a mindset. You know, if you continue in the same mindset that you started in that caused the condition, it's hard to change it. You know, it's hard to get better, no matter what medications you're on, no matter how many times you go to the doctor. It's really a mindset thing. And I know Andra talks about that a lot on her platforms. So yeah, it would really sadden me when I would go into these different homes and I would see the patient conditions getting worse. And my goal as a community nurse, a visiting nurse, was to keep these patients out of the hospital, to keep that revolving door from turning, you know, keep them home, safe in the community, healthy in the community. And it was challenging to do that if they didn't change their lifestyle.
Yes. You know, it's so true. And, you know, but as nurses in the hospital, we do prevention with them. And it's so important that before they're released, we ask about these things that you're discussing, like where is their local market? How far is it? Do they drive? Do they have access to transportation? Because so many people don't. They don't drive, and they do have just those bodegas in their neighborhood. And insecurity, like food insecurity, is everywhere, and it breaks my heart. But so canned foods are not the worst. You can rinse them off in a colander and get all those additives off, because sometimes people go for what they can afford, and you want to find ways to let them have, you know, a lot of people talk about organic, and that's just really the way it's grown and stuff. And you know, they think that fresh is always better than frozen, and that's not the case too. You know, you can rinse those frozen vegetables and get out all those preservatives, and frozen fruits last longer, so there's less waste, especially if you don't have that money. It's so important. I love what you do. I was just offered a job to go back to that, to really be visiting. I'm not really sure I want to do it. New York's a little different than it usually is. I'm not sure if I want to go back into that really high stress with all my immune, because I have a job where it's really cushy and there's no stress. I'm my own boss. So, but I'm thinking about it. I have a couple of months to decide. I know it's not easy, especially some of the things you witnessed, because I know, like, you know, I did home care for a lot of years, and I know that there are people that are elderly, and even people that are not, Karen, that are choosing between food and medications.
Absolutely.
And they can't afford it, you know. So we really do want to help them with their lifestyles to even eliminate those extra costs of medicines, because if they do change their diet and they do change their lifestyle, that's the medication can come out of that picture.
Absolutely.
You know?
I agree. Mm-hmm.
So that's my hope. But sometimes, you talked about mindset, and mindset is a really big part of that. I worked with you after, I had lost a lot of the weight, so you didn't see me at my biggest. But mindset, even though I knew what to do, and you used to remember me outside smoking those cigarettes, I was
Right.
like, I'm gone,
Yeah, I was
yeah,
like,
talking about health with a cigarette hanging out of my mouth, and talking about who's going where after work. So, it takes time to really get your mind in that place. And it's not perfect. You know what I mean? It's not always perfection. You just have to do the best you can do,
right.
and little by little you can make small changes. But for me with mindset, I didn't, even though I was a nurse and I knew what I needed to do, you always look to someone else because you somehow feel that you're not equipped to do what you need to do. And it wasn't until I really said, hey, I know this shit. Why am I asking somebody else that that I really changed that in
Right.
myself? And that's when it really started to happen. And it's great that you get to work with these people and really empower them to make better choices for themselves and their health, and that, I know you have kids, so this is in your home. You're teaching this in your home. It comes everywhere. So from a parent point of view, because I know you got little ones running around behind you. I know, I remember. So
Once the camera, they want to be in it. I'm like, what?
it's okay. You're human. We all have lives. So what I want to say to you is, what is it like for you to, because you do know the things that are out there, because you are in the public. So not just the crime, but the lifestyle and all that stuff. What is it like for you to try to teach that in your home when kids just want to be kids, and they don't want that broccoli, and how do you incorporate that into their life?
That's an awesome question because I know the end result of a poor diet. It is very important to me to teach my kids, what to eat, how to eat. I'm not the iron fist type of manager, nurse, or parent. So I do believe in moderation, right? So I don't go, oh, pescatarian, don't eat that. Don't do everything in moderation. I believe that helps all of us. That helps me. So with my kids, it's through food shopping. I take them to the supermarket with me, and I help them to see what is good to eat and why. And my kids are really, really smart, not just because they're my kids, but they're on the internet. They see disease processes. They know I'm a nurse. They hear me talking on the phone. So my son will frequently ask me, what causes things to clog arteries, or what causes a heart attack, or what makes a stroke happen? And it helps me to teach them what foods may cause that consistently and what foods may prevent it. So I do a lot of teaching when it comes to going to the supermarket with them, with keeping my refrigerator loaded with fresh foods. So it's more of a hands-on approach that I take with them, more than I'm just like, badgering them. And being that it's moderation, if they want something that is high in cholesterol, chicken wings, it happens. Okay, you can have the chicken wings, but tomorrow we'll have a smoothie, a smoothie with kale, broccoli, some pomegranate, some powders. I do have a lot of, my husband and I do shop, and we use a lot of powders in our smoothies for the kids.
Yeah.
Like this is a turmeric powder.
Yeah, love it. Love it. I got all that in my cupboard, girl. All of it.
And we have like this flaxseed one because my husband is challenged with a little bit of high cholesterol. So, it's really just helping my kids to see hands-on what things can cause. And it helps that I'm a nurse and that they listen to my conversations with my patients, because it kind of scares them straight.
Yeah.
See what to do. So I think that's great if you have kids to just, bring them in, pull them in to what you're doing, and they'll learn, they'll pick it up. They're like sponges, they'll pick it up.
That's so true. So what's next for Karen? I know you do this. I know you do the CPR. You're an instructor, and there's a lot of need after that. Right before we went live, I told you that I recently did one and it was like a comedy routine, the guy that was doing it. I mean, he was very funny, but it wasn't what you're used to going and seeing, and I had the skills, so it was okay, and we got through it. But that was back in August, and I still haven't gotten my card. So so you wonder. But CPR, I want to just talk about it. Like, I think that everybody should have CPR and first aid, whether you're in healthcare or not, because the country is getting sicker. We all have family members. There's a lot of people out there taking care of their family members, that can't afford to have someone live in and take care of them. It's not that kind of ecosystem anymore, where you can do that. So, what would you advise on someone that wanted to learn CPR or, just basic life, first aid?
Yeah. So prior to COVID, we all went to a facility, a room, and learned CPR, right? It was hands-on. So now they have these online CPR trainings, which are great because you're still getting the education. But I believe everyone does need some sort of hands-on approach where you can actually touch that dummy and do your compressions and do your breaths, and the instructor can keep you up to date on the changes, because things can change. There may be
Changes all the time. It changes all the time.
It changes all the time. So you really need to stay up to date or abreast on the changes with how to revive someone, what you should do, how to stay safe. I think the biggest thing with first aid and CPR, like you said, is that everyone should know it. Everyone's a human being. Everyone deserves a chance to live if they can, right? To be revived if they can. So whether you're a parent, a student, anyone on the street, homeless. Like I go into homeless facilities and I teach first aid and CPR, because sometimes, things happen on the street. It may be someone that they're sitting right next to. In my area now, we have a lot of homeless communities, tent communities, they call them. So what's next for me that you asked is really getting into those tent communities and educating the homeless on first aid and CPR, or trying to find housing for them. It's really close to my heart. I hate to see someone without a
Me
roof
too.
over.
It breaks my heart. And they're getting younger and younger and younger. Now there are some people out there that have just been out of the system so long that they prefer to stay out there. They don't do well in conformed areas. And there's a lot of people with mental issues right now that are out there. And of course, they're homeless too. But I think that, when I go through the city in the morning, Karen, I have never seen New York as bad as it is right now with homeless populations. And it breaks my heart. So I'm glad you're on this job. I might even come and help you, girl, because it's close to my heart.
Oh, we can create some sort of organization for New York and help New York out. Believe it or not, New York is one of the biggest cities, the best cities for homeless to get housing. I used to be a director in a facility that treated homeless people, human beings, because I want to make sure we always see each other as human beings. And we must have served 300 human beings that were homeless a day. And when I say serve, they blood pressure, medication. We was a one-stop shop. Psych. We fed them breakfast and lunch. And it was right there in the South Bronx. So I know a lot of people from different states come to New York to get homeless housing and benefits. So I'm your girl. If you want to start an organization and get out there, I will take the train up. I have not a problem to do it. I know
I will do it with you. I will do it. If I commit to something, I'm there. I got my hands in everything right now. And the more I put my hands in, the more I love it.
Right.
People say to me, don't you get tired of doing this? And I'm like, no, people, when you're online, they want to see what you're doing in your life, aside, get to know you, outside of work and what you're doing. And this is what I'm always doing. So it's kind of hard, they're like, don't you go here, don't you go. I do, but then I wind up back in what I'm doing. You know what I mean? So I'm always working.
Definitely your mission. From the time I met you, you've been helping. help anyone, anything. I said, I remember saying to you, I want to get a job where I can help people and work from home. You were like, really? Do this job. I was like,
I love it. I love it. I'm still out there. I'm still out there working though. I had shared with you earlier that nursing, like when we got into nursing, I was in a little earlier than you, but it was like the Florence Nightingale era, and everybody aspired to be that helper, to be that advocate, to be that social worker, because we wear so many hats, and today there's not that same love because it has become so much of a business. And when I said to you, I'm really not so fond on nursing anymore, you were like, oh, yes, because it's not who we are, and we were always running the facilities, but we were always at the bedside, and people didn't understand, why can't we find you? Why are you always in a room with someone? But we were always there helping, because that's who we are. So this is my way of doing that. I'm glad you're doing the CPR and stuff like that. We're going to talk more about this homeless thing, because it's something that really, really, really breaks my heart on a regular basis. And I take the subways every morning, and every morning I pass 15 to 20 young people or people that are in wheelchairs, Karen, and you know what I mean? And they're sleeping, all disfigured, and you don't know when the last time they had a meal. I always carry those little snack bars with me, and I'm like, I feel like I'm handing them out every day,
I'm like giving out the whole paycheck. I'm like, here, you take this, you take that. Like,
I know.
It's like you said, when nursing was first came about, it came about through just caring for people, period. There was no, nobody was thinking about the money. It was just like, I just want to care for human beings. The profession has blown up so big where there's a concern for how much I'm going to get paid before I care for this person, for some nurses, which, we give our lives, so we should be compensated, but we should never forget why we started, never forget why we're doing what we're doing, because we really do love caring. We love making sure human beings are being taken care of, and that they're growing physically, mentally, spiritually, like that love, it will keep you going. And if you don't have it as a nurse, the burnout will come quick, because when you get 15 patients that night, and one is falling off the bed, another one's wound is diseased, the other one needs a blood transfusion.
I know.
Burn out if you don't remember why you started. So that's why I love you. And from the first day I met you,
and the next shift calls out, and you find out you got another 15 hours in it.
24 hours. I remember being there like 48 hours. I'm calling my husband, another day. And that was before COVID.
I know. I remember I would leave, and you were coming in. When I came back, you were still there. And I was like, damn, girl, didn't you go home? I used to get mad at you for driving tired. I was like, you can't drive tired. It's worse than driving drunk, Karen. You got to stay, hang out, go to sleep. I know. It's crazy. But I really love what you're doing. And you gave me a QR code for people that want to do. I know you're on Telegram. Do you have a group there on Telegram? Or
group? No, I can start one. And if anyone wants to reach out, I can definitely start one. You can even,
because I know I've come into your group where you are with prayer. Sometimes I'm in there.
Yeah. I definitely believe in prayer every morning, honey. Without God,
I know. Listen, we're his people. He takes care of us. Believe me when I tell you. So I'm going to put the QR code in after this. You're definitely going to stay in touch. And anytime you want to come in and come in the group and share your experience with help and do some teaching, I would love to have you, because you're someone that I know that I believe in this group in good hands. I know, really. So anytime you want to come in and do a little teaching session with them and what you're doing, I would love it. Okay.
Definitely. Whenever you need me, I'm free. Just, drop a word in WhatsApp every morning when I wake up. I read your post. I get my inspiration. So whenever you need me, I am here.
But it could be just Yeah, but like even if you're doing something different, I always like, I know that I have all these moving parts in my life, and so do so many people, so I know that a lot of people feel uncomfortable coming out and sharing, because I said to them, if you're doing something, and I just said to my girlfriend, she makes these adorable headbands and it's Christmas, right? And I said, Christmas has really been about like gifts and this and that. Save some money this year, make some gifts. I said, why don't you come in my group and share how you do this, and put that idea. Because haha, really? I said, yeah, really. I said, because my mother used to love when I made her a card. You know what I mean? And God help me if I didn't give her one. So I made them a lot growing up. So I'm serious, so people need to hear what other people are doing, because it really inspires them to really share what they are doing. A lot of people out there haven't found their voice yet, but I believe everybody has a voice and should be heard. And I think everybody really contributes to the community.
Yeah, we're all special. We are definitely all special in our own way, and it does need to be put out there. That's what I love about the internet now and social media, because everyone could really share, what makes them special, and someone can take a piece here and a piece there, and grow from it. But let me know. I'm making chocolate candies with my daughter this afternoon, and then we're putting up Christmas decorations. Whenever you need me, just let me know, and I'll also drop you a line if I'm doing something and I could,
Yeah. Okay. I would love that. All right. I'm gonna sign off from you guys, but I wanted you to meet Karen. Karen's amazing. So if you're looking to learn first aid or CPR, I'm gonna drop a QR code in after this meeting airs. So that you can reach out to her, and she does a lot of consulting. So if you have concerns about someone in the aging population, or just someone with health issues, you can reach out to Karen. She's a great advocate. She can absolutely refer you to resources, to someone who can help if she can't, like if you're looking for healthcare advice and stuff like that, because her day-to-day job is really that, helping people find better healthcare and stuff like that. So she would love to help you. We're going to keep you real busy, girl. All right. All right, guys, have a great day. See you soon.
All right, bye, Sandra. Thank you so much.